I welcome you all in the next video tutorial of pharmacy practice. So dear all, in this video, we are going to cover a simple topic of, yes, the learning objectives are, after watching this video, you will be able to know about the different role and responsibilities of overall medical staff. So in hospital, we have different categories of medical staff, like doctor, nurses, allied health professional, and supporting staff. In the doctors, we have senior consultant, registrars, residents, interns, and student doctors. Nurses, we have nurse unit manager, nurse practitioner, special nurses are there, registered nurses, and enrolled nurses. And in the healthcare professional, that is the allied health professionals, we have dietitian, occupational therapist, the backbone of the hospital, pharmacist, yes, physiotherapist, and the speech therapists. In supporting staff, we have clinical assistant, porters, ward clerks, volunteer, then we have patient service assistant. So let's cover them one by one. As you can see, medical unit of hospital comprise of following personnel according to their designation, and they are assigned to perform the various activities as mentioned below. So we have doctor, nurses, allied health professional, and supporting staff. If we talk about doctors, so these are the main functioning without which hospital cannot run. The doctors can be consultant as a specialist, the registrar of hospital, and the resident. All of them assess special patient medical care. They're responsible for directly responsible for the providing the patient medical care. So there are different type of level of experience and their medical specialty. They're categorized in different categories like senior consultants. So these are these specialist doctors who see the patient at a specific time intervals and mostly during ward rounds and meetings. We have registrar. These are the senior doctors and are responsible to supervise resident interns and student doctors. Afterwards, we have the residents, that is these are the doctors responsible to look after the patient or the ward and are under training for specialization. We have interned. So these are the medical students. They are engaged in further training after finishing graduation. Of course, we have student doctors. These are the undergraduate medical student doctors who are supervised by attending physicians. In the next category, we have nurses. The nurses are the majorly responsible for carrying out treatment plan which is established by the physician. We have nurse unit manager that runs the ward, and of course associate nurse unit manager who is also there to help and assist the nurse unit manager. We have nurse practitioner. These are the highly skilled and has an advanced level of training. We have special nurses, registered nurses, and of course the enrolled nurses also there. And registered nurses are responsible for high level of day-to-day care and perform some basic procedures. If we talk about the enrolled nurses, they are responsible for the provision of basic medical care facility under the observation of more senior nurses. So this is again the very important component, the nurses. Allied health professional, that is dietitians. These are the specialized nutritional medical training personnel which are able to provide the proper dietary plan as per the patient condition. Occupational therapists are there to assess the people's ability to do their daily activities. We have pharmacists, the backbone of the hospital, I would say. So these are the team or the person who supervise the use of drugs in hospital. They also involved in the provision of education on how to safety and effectively consume the prescribed drug. So these are the person responsible for having the proper dispensing of the drug to the patient, as well as involved in different types of discussion with the physician also. Whenever there is a prescription error, pharmacist can intervene in that, but do consultation with the physician. He cannot change the prescription, but he can advise to the physician if there is an error. The pharmacist plays a very vital role. Physiotherapist, they examine and treat the people who have difficulty in physical movement and also help them to function better physically and become more independent. We have speech therapists. They work closely with the patient who have any disorder that interferes with the communication or the swelling issues. We have interpreter services also there in the hospitals. And rapid response team is actively 24 by 7. So these are the group of designated hospital staff, mostly comprising of a doctor, nurse, and the respiratory therapist. And these teams are very alert and quickly come to the patient room if in any emergency situation. So we have other medical staff also that are responsible for different day-to-day activities hospitals, like clinical assistant. They're responsible to take care of the ward housekeeping. We have patient service assistant that take care of the meals of the patient or any other requirement of the patient. We have porters that are responsible for take care of patient when lifting and during transport. We have volunteer to help and fundraising and different ward visits. We have different type of clerical sections are also there that are available 24/7. So I hope this is clear too. You have to remember the jobs, role and responsibilities of the all the medical staff. Yes, we have covered this point. Again, recall doctors, nurses, allied health professional, and the supporting staff. So I hope this is clear. So in the end, I acknowledge all the sources that I have used to prepare this video. This is for education purposes only. There is no commercialization. Thank you all for valuable time.